Alrighty. Good morning, everyone. I wouldn't be lying if I said I was not nervous to be up here to do this presentation, but I'm happy to be here. My name is Misha. I'm a clinical mental health counselor at Piedmont Medical Macon. And I'm here to do a presentation briefly about anxiety and depression. I'm sure you guys often hear about anxiety and depression all of the time. And it's probably one of the common mental health disorders that a lot of people, suffer with, but most times don't really know that they're even experiencing it or know how to get help for it. So hopefully this presentation kind of gives you a little bit more insight on what it is and how to get treatment moving forward. So, all right, let's see. PowerPoint come up? Okay. Oh, because I couldn't see it up here. Sorry, guys. So, mental health should be a priority, of course. As it says, 1 in 10 Americans over the age of 18 years old suffer from depression. Depression affects every part of one's day. Depression is 3 times more likely in patients after acute heart attack. Why? Because it's a two-way street. So like I was saying before, that when it comes to mental health, it really does not discriminate regardless of how old you are or what background you come from. And that there's so many different factors that kind of plays a role in depression, especially if it's like you experience some changes that was out of your control or any health complications or any issues like that we feel helpless or even hopeless in situation kind of trigger that depression. Alrighty, guys. Okay, so I'm sure you guys hear this all of the time. When you're feeling really sad, people says, well, you've been moping around for days, just get over it, right? Just be happy. But when it comes to depression, it's a little bit different to just having like 1 or 2 bad days, right? Because when you have depression, especially clinical depression, it's really difficult to kind of get out of that foggy, negative mindset, right? When you're feeling depression, it's like this dark cloud is over your head, right? You feel like you have no control over your mood. You have, no motivation, no energy to really do anything, kind of feeling like a little blob a little bit, right? And sometimes you just like, I don't know why I'm feeling this way. I don't like feeling this way, but I can't do anything about it. So that's usually what depression is versus, having just a bad day or two. And simply just telling someone, hey, just get over it, it's not that simple. If it was, I'm sure we all would have done that. All right, next slide, please. All right, so whenever you're dealing with depression, there are all different types of symptoms that can affect individuals, and it looks different for everyone, but the most common ones are your sleep. Whenever you're dealing with clinical depression, most likely you probably sleep a lot more than you would like to be, like you're in bed more because you have low mood, low energy, you just don't want to do anything active whatsoever. So you find yourself sleeping a lot more than you normally would. And also your interest, right? Your daily activities, your hobbies, things that used to bring you joy and pleasure, it just does not excite you anymore. And it's not just saying you lost interest of it, it's just that right now the moods, you're just not in the mood for anything anymore. And also guilt. Sometimes you kind of feel guilty about, why am I feeling this way? I don't want to feel this way, but I can't control it. And like, why is that? Also when you're dealing with depression, like I said, sometimes you tend to neglect responsibilities because you just cannot, take care of them. Not because you don't want to, but your body just physically will not allow you to be active and mobile and be functional like you want to. So sometimes that kind of comes with guilt. And then, like I said, energy before, low energy, low mood, and also concentration. If you can't really concentrate on anything else, it's kind of hard for you to continue doing about the daily things that you used to do. Because right now, all you're really focusing about is just, this intense sadness that you're just feeling. And also appetite too, right? When you're not feeling good, most likely the main thing that goes away is your lack of appetite. Usually, same thing with clinical depression. If you're not really feeling well mentally, appetite is one of the things that usually would go, or sometimes the opposite. You tend to overeat than you normally would have, just trying to make yourself feel a little bit better. But usually that's one of the things that's impacted as well. And also psychomotor slowing down. Like I said, when you're feeling low energy, especially when you can't get out of bed, you're kind of like slagging around, right? You're really sluggish. For some people, it's so bad to the point where they can't even sit up in bed, right? Like they can't even have the energy just to push themselves to sit up in bed. And again, it's not because they want to, but it's just, they just lost all control of, their motor skills and their moods and things like that. And the biggest symptom is probably like the most important one is suicidal ideation. And there's two different types of suicidal ideation. There's passive suicidal ideation, and then there's active suicidal ideation. So passive suicidal ideation is basically the thoughts only. Thoughts were like, I wish I wasn't here anymore, or I feel like my pain, whether it's physical or emotional, mental, will go away if I was not here anymore, or I feel like I'm a burden to my family or my friends, and I think their life would just be easier if I was just not here in this world anymore. So that's just the thoughts only. But active suicidal ideation becomes a little bit more serious. Now, not only are you having the thoughts about suicidal, now you're starting to, act on it, meaning that either you start making a plan or you start being more serious about it, whether you're writing a suicide letter, whatever it may be. So that's usually a huge major warning sign, like, hey, something is really wrong. Because the average person, even though there are certain things in life that is out of their control, not wanting to be here is usually not the first answer that pops into their head. All right, next slide, please. All right, so different things that can cause depression. So one thing is vitamin D deficiency, right? So a lot of us nowadays, we're usually inside, working. And we're not outside as much to get vitamin D from the sun that kind of produces that energy that we need, especially since COVID. A lot of things have been telehealth, so we're not being out as much like we used to. We're not being as active like we used to before. So usually vitamin D is one of the main things that kind of plays a role when it comes to energy level. And then different disorders like thyroid disorders, anemia, cancers, or any chronic illnesses can also trigger a clinical depression, because again, these are the things that are pretty serious. These are major things that are major changes that's out of your control in your life, but also that can impact your life in a huge way too, right? Especially is that, I'm dealing with this chronic illness. I don't know what to do. I don't know what my life's going to look like, or I'm no longer the version of myself that I used to be, or I can't continue living the life that I used to live. So now I just feel helpless and I feel hopeless. I feel stuck. You can't see the future. All you can just see is just, quote unquote, pending doom, or however you want to describe it. So you're kind of stuck in that negative mindset. All right, next slide. All right, so when it comes to depression or any other mental health disorders, genetics does play a role. So I'm not saying that if someone in your family is diagnosed with clinical depression doesn't mean that you're going to guarantee have clinical depression. It just means that you might have a higher chance versus someone who doesn't have family history of mental health disorder. So genetics does play a role, whether it's just depression, anxiety, bipolar, schizophrenia, even substance use of addiction. Those also can play a role too in increasing the chances of you getting it. I'm not saying it's 100% guaranteed, but it just kind of increases your chance of much higher. And also recent stressors too, whether it's trauma, something traumatic that happened to you in your life, whether you were young or, old or whatever it may be. And when something traumatic that happens to you, sometimes it kind of builds in with that guilt, right? Or that shame or that blame that you feel on yourself. And again, that hopeless and that helpless situation, because again, what can I do anything about it, right? Why didn't I have more control over the situation? So sometimes that kind of starts feeding into that negative mindset, which then kind of triggers that mood. And then also low social support too. As human beings, we're meant to be around other individuals. We're meant to be in a village. We're meant to be around others to give us the support. And sometimes we don't have that. Especially when you're going through a lot in life, we all need help to some degree. But sometimes when people don't have that at all, it can be very, traumatic for them, or very helpless. They feel helpless or hopeless. So, I'm trying to get my life in order, or I'm doing everything by myself, or it's getting too much and I just can't deal with the stress or the pain of this anymore. And then you start feeling really depressed about it, feeling really sad. You guys can go back really quickly. But the neurological part of the depression, well, I'll talk about it because I think I remembered from the previous slide, is that also not only genetics plays a role in depression, but genetics plays a role as well too. And what I mean by that is our nerve cells. So they're neurotransmitter or nerve cells that how they communicate with each other that impacts your moods and how we feel. So there are three chemicals, dopamine, serotonin, and then I don't have it up there. It's okay. But these are the chemicals that plays a major role in our mood, right? Those are the chemicals that make us feel good, that makes us feel happy. So whenever we do something that gives us joy, those are the chemicals that activates those emotions. But when you have clinical depression, those chemicals become imbalanced. So that's what kind of causes you to not have any pleasure or any excitement from the things that used to bring you joy before. So usually that's another tell sign that something is wrong. All right. I think we might have like a little technical difficulties. You're fine. I know. But for those who walked in, I guess I could do a brief introduction again. So my name is Misha. I am a clinical mental health counselor at Piedmont Macon Hospital. So it's nice to meet you guys. So thank you for being here. And then we're back. So so those are the 3 chemicals that we're telling you about. And also another thing too is that when you have severe depression, that sometimes it can cause like psychotic features, right? Because again, now those chemicals in your brain became so imbalanced to where you start to lose touch with reality. And the thing is, I want you guys to think about when it comes to mental health, think of it like a spectrum, right? There's either mild symptoms of mental health, there's moderate symptoms, and then there's severe symptoms. So mild, usually most people are able to kind of manage those symptoms on their own. And moderate means they probably just need a little bit more extra help, or there's just a talk therapist, someone that you're talking to kind of guide you through the stressors that you're dealing with, and you might need a little bit of medication. And severe clinical depression or any severe mental illness requires medication and also therapy too, because sometimes when you're dealing with severe mental illness, talk therapy is not enough to work. And what I mean by that is if you're having hallucinations or you can't even get out of bed, then it's going to be hard to have a therapy that's going to be very effective. So sometimes having that medication can kind of help balance those chemicals that we talked about to kind of make things a little bit easier with you. And finding a provider like a psychiatrist that you feel safe with, that can tell you more about your symptoms and your diagnosis, and to find the right medication to help you with that. All right, next slide, please. All right, so gender difference in depression. So men and women, all deal with depression as well. However, men are more likely to have depressive episode following a divorce, separation, or work difficulties. So for men, society's like, men, you're really tough. You're supposed to have it all together. You can't really show emotions. But, men are not exempt from any major life changes too. And, one of the major things that we talked about is, separation or divorce or losing their family or even their job. Those are major significant things in their life, especially when they have no control over it, especially if they can't find any answer to that problem that they're currently dealing with, so they kind of feel stuck. And also probably don't even feel comfortable being able to talk about how they're feeling, which then increases that depressive feeling as well. And then for women are more likely to have depressive episode due to sensitive events in their proximal social networks, such as difficulty getting along with another individual, serious illness, and death. So as women, society says we're the emotional creatures, right? There's a lot of things that kind of triggers our emotions, that kind of makes us, really upset. And as women, we're kind of involved with a lot of different things too. And what women is a little bit different as well is, I'm sure you guys probably heard of like postpartum depression, right? After you've given birth, you're either not connecting well with your child, or you kind of feel helpless and kind of really sad, and not because you don't want to be happy or connected with your baby. Again, it's just that chemical in your brain. And also just, taking care of the household, going to work and doing all these things. And sometimes when it becomes too much and you don't know how to get help or to do something about it, it can become overwhelming, which then can trigger clinical depression. All right, so we talked about medication earlier before too. Medication is 60% effective. And I know some individuals may be like, well, I don't like taking medication because, due to the side effects, or I don't trust it, I don't know what I'm talking about. And that is perfectly, okay. So that's why I always encourage you guys to kind of talk about your fears and concerns with your providers, and then they can find the least, they usually start you off with the lowest dosage just to see how you respond to it, and then kind of slowly increase to see if it starts to help or not. And also there's some psychiatrists out there who do like holistic approach to kind of figure out, okay, what are some holistic things that we can do before we do, depression. And usually talk therapy is one of the holistic approach. If that's still not working and you're still experiencing those physical symptoms of just, feeling like no matter what you do, life is just going to be forever this dark place, and you probably need something to kind of help balance those chemicals in those brains, and that's what medication is there to help you. All right, so now generalized anxiety, our favorite topic. So there's so many different types of anxiety when it comes to that. There's social anxiety, there's generalized anxiety that most people have, or acrophobia, basically. So think about anxiety as basically it's just like the fear of the unknown. That when you don't know what's going to happen, when something's out of your control, you feel, really uncomfortable. So basically that part of your brain is looking for danger, which then triggers that fight, freeze, or fight mode that activates. And I can use myself for an example right now. Public speaking, believe it or not, is something that makes me really anxious. My brain right now is telling me like, hey, Misha, you're in danger. You need to run away and get off the stage and hide. But rationally, I know that I'm not in danger, so that I am okay. So sometimes anxiety could be like that. So some people, when they have anxiety, once they kind of face that fear, they're okay with it. But other people, their anxiety can be so severe to the point where they can't even step out of their house or just have a simple conversation with a stranger. Alrighty, so emotional symptoms that we talked about. So anxiety, overthinking, when you have like a lot of excessive worrying all the time, uncontrollable thoughts, it's like you going to sleep, you're just constantly worrying about something. Like no matter how hard you try, like your brain would just not turn off whatsoever. Or you find yourself worrying about every little detail that goes in your life, something small, and you start to snowball into something bigger than what it's not. Then to the point where it starts impacting your daily functioning as well. And then some physical symptoms that you may have when it comes to anxiety is either fatigue, sweating, shaking, numbness, heart rate is racing, your temperature may come up a little bit more. So sometimes, people have like their anxiety little tics, either like intensive like tapping of the foot or fidgeting with their fingers or just pacing all of the time. So sometimes anxiety looks different for everyone. They usually are like the common signs that people have too. Sometimes irritability or nausea at some points where like you get so anxious to where you're constantly vomiting all of the time. All right. Next slide, please. All right. So same thing, similar to depression, is genetics does play a role too as well. So with anxiety, it's one of those things where I always ask, the patients that I work with is, usually we're feeling really anxious, right? But then sometimes if you're raised like in an anxious environment, whether it's your parents that's constantly worrying all of the time or whatever it may be, or your guardian, sometimes we kind of pick up on that habit, right? We tend to be fearful of even of our own shadows or everything that we tend to do. So I always ask them, whenever you find yourself really anxious or really worried, sit down and kind of break it down and ask yourself, the thoughts that I'm having, is it rational or is it irrational? Because sometimes if it's irrational, simply just identifying that thought and then challenging it with the reality and the facts can usually kind of help ease that anxiety. But if your anxiety is really severe, so just talk therapy, just practicing those coping skills by itself is just not enough. So you might need medication too. Or just taking a deep breath or doing something that kind of distracts you from the thoughts. So what triggers anxiety is simply a thought that has, you have a thought which then influences your mood, and then your mood then turns into a behavior. It's like I was using the example earlier about my stage fright, right? If I were to pay attention to the thoughts that I'm having, like, Misha, they're all looking at you, they're probably all judging you, whatever it is, is your pants on? If I focus too much on these things, then it'll make it really hard for me to function and to not be able to do the things that I need to. But because I'm able to kind of take a moment and take a deep breath and pause myself and just say, you know what, the reality is, like, no one is judging me, hopefully not. And my pants are on, that everything is okay. So sometimes you have to prove to yourself the thoughts that you're having, it's just not realistic. But when you're in the moment of having anxiety or even a panic attack, it just feels really real. And sometimes you need somebody to kind of help you get out of that mindset. All right, so some medications that you would usually use to treat anxiety, and I'm sure the most common one you guys probably hear is like Valium and Xanax, right? Those are like the two popular ones that, you usually use it along with other kinds as well. So talking to your provider and asking them which one is right for you, because it's not one treatment fits all, right? Everyone's medical history is different, everyone's family history is different, everyone's genetics is different too, right? So talking with your doctor and kind of having them explain to you what each medication does and see, hey, is this the right fit for me or not? Or like, I've been dealing with these symptoms for a while, what would you recommend? And usually they'll give you more information about it. So medication is not my strong suit, so I'm not gonna go into like a lot of details, but I do know the basics about it though, plus therapy. So When is it safe to stop an antidepressant? Or not just any antidepressant, but also for anxiety too. I hear patients that I work with all the time say like, hey, I've been taking my medication as prescribed, like I've been needing to for the past 6 months, and I feel wonderful. I feel energetic. My thoughts are not as out of control before. I don't feel fearful. I feel like my old self again. I'm happy. So I just stopped taking the medication. And I'm like, oh, okay. Well, did you talk with your doctor about it? It's like, no, I just decided to stop doing it. And then next thing you know, they start reverting back, right? The symptoms start coming back over again. So I always tell individuals, think of it this way. Whenever you're taking any antipsychotic medications, treat it like it's antibiotics. What I mean by that is usually when you take antibiotics, even though when you start feeling well, you're supposed to do what? Take all of it, right? And don't stop. So that's where it's really important not to self-medicate or take that judgment upon yourself. So that's where it's really important to talk with your provider before you just wing it off. And some providers will slowly start to taper you off the medication instead of just stopping cold turkey. All right. I survived. Did you guys have any questions? I know I kind of talked a little fast through about the depression, but anxiety. Any questions or any concerns or anything? You guys are my kind of crowd. Thank you. All right, everyone. Thank you. Actually, you guys, I do have one more thing to say. I completely forgot. I'm sorry. So if you're dealing with mental health personally, or if you know any family members that's dealing with mental health and you don't know where to start, one thing you can do either is call your insurance company and ask them to give you a list of therapists and psychiatrists. That's your provider. Or like I said, I work at Piedmont, Macon. We treat outpatient services where we treat all forms of mental health and substance addiction. So if you ever need extra help, those are the places that you can. And if you ever want any business cards about Piedmont, I do have some that could talk more with you guys afterwards. But again, thank you.